name is Olatunji Shoti-Miri. I'm a performing artist and, television radio presenter and a university lecturer, Unilag. Keep watching Souq News.
Hello everyone, my name is Kenny Black, Africa's finest music comedian, and you're watching Souq News. If you're not watching Souq News, I pity you, but keep watching Souq News.
Hello everyone, my name is Timmy Dakolo, and you're watching Souq News. Stay tuned.
Hi, my name is Wisdom Oluwaseun Okoko, co-founder Orbit Africa Properties. I'm live at Souq News. Guys, keep watching Souq News for everything that concerns business, economy, politics, news. Souq News is your station.
I'm okay.
My name is Raymond Bola Brown.
Hi, my name is Fred Amata, and you're on to Souq News.
If you are watching this channel for the first time, make sure you continue to watch it because this is Souq News.
Shout out to Souq News. Actually, I don't know. I really enjoyed the little moment I spent with you, and I think with more of this.
Souq News. Here's the Souq News who had the courage to transcend a locked off camera and actually have a conversation with a human being. It's a pleasure, Souq News. Thank you very much.
My name is Dr. Rafiu Oladipo.
My name is Baba Jalal Repega.
I'm Reverend Juliet Benite.
I'm Godi Odidi.
My name is Professor Oladokun Sulaiman Olarawaju.
Souq News is on the ground, loading.
Very enlightening, very educative, and entertaining.
Thank you to Souq News.
So I'm happy that Souq TV has come into existence.
I'm happy to be here in the Souq News.
I want to encourage you to subscribe to the channel and keep watching news that makes sense.
As Browning said, one's extension of one's reach should not exceed one's grasp, or what is heaven for. And I think Souq News is doing that.
Africa needs a voice of truth, and Souq News has become one of them. And get ready, get ready, get ready.
And keep watching.
Keep watching Souq News.
Keep watching Souq News. It's a place to be.
Keep watching Souq News.
My name is Dr. Agility Obi.
My name is Etemere Glover. Naomi, well done, and shout out to Souq News.
Shout out to Souq News. I want to encourage everyone to keep watching Souq News.
Shout out to Souq News, and yes, tune into them.
Keep watching Souq News. They are one in town.
Hey, we're watching Souq News.
Keep watching Souq News.
Keep watching Souq News. Catch them on YouTube and all social media channels.
Hey, my name is Frank Edowo, and I'm imploring you. No, forget that. I am forcing you, coercing you to always stay tuned to Souq News for your news requirements.
Yes, hello and welcome to Souq Pulse. It's nice having you once again today. I'm glad you're still here. The last time we talked and we had a nice conversation, we were looking at improving the value chain of agricultural products in Africa, and that has been a nice one. So today was that yesterday we talked about, and today we'll be looking at something quite different. We are that particular program that put a searchlight on things that you call a problem, be it policies being made by different countries, or be it development agencies that are coming in to help, assist, grant a loan, or supervise a particular policy making, be it business issues that affect not just countries that cut across borders, be it organizations and facilities that help a country grow their economy. We'll put our light on them and get to see how well they're doing. Is it positive? Is it affecting the people? Is it letting businesses thrive? Are people complaining? And at the end of the day, we'll sit back and say, hey, this is a problem, but the solution is what we'll seek on Souq Pulse. And just like Souq News, we are here to make a difference and show you that programming can always be different. Today on Souq Pulse, we'll be looking at something that is quite alien to a lot of people. It's a term that have come to stay. whether we like it or not. Every country is looking for ways to show up their GDP, and they are working at it seriously. So we've dealt on African issues for a long while, 6 days now. We won't get tired of it. We've also looked at what is happening in Asia and say, okay, what can we copy? How can we get better? How is Asia doing it? How is Europe doing it? How are they also lending a hand? Or how are they making money off it? How are they making profits off it? So today we'll be looking at health tourism. Yes, health tourism. It will sound strange to you coming from West Africa. You'll be wondering why health tourism. Yes, we are not looking at just being able to provide universal basic education. We're not looking at being able to provide universal health coverage. We're looking at being able to save those billions of dollars that leave the shores of Africa every year to destinations where people have thought things out and made it possible for you to come around and make sure you stay healthy. And in return, you part away with your hard-earned money. So how can Africa show up? How can Africa grow up? How can Africa be a part of this? Well, first you need to take care of your people. What is our budget saying? What are the populace looking up to? What are the facilities like? What are the professionals like? How hospitable are we? These are things we are going to dissect through this particular show for today. And I promise you, at the end of it, we'll look at ourselves in the face and say, yeah, it's nice we had this conversation. I'll be joined shortly by a guest. And before then, we'll go on a break and our guest will be up and we'll have a very good time. Just hang there. It's just less than an hour with us. Souq News is where you sought to be, and Souq Pulse is where you are right now. My name is Souq. Don't go anywhere.
My name is Dr. Rafiu Oladipo.
My name is Baba Jalal Repega.
I'm Reverend Juliet Benite.
I'm Godi Odidi.
My name is Professor Oladokun Sulaiman Olarawaju.
Souq News is on the ground, loading.
Very enlightening, very educative, and entertaining.
Thank you to Souq News.
So I'm happy that Souq TV has come into existence.
I'm happy to be here in the Souq News.
I want to encourage you to subscribe to the channel and keep watching news that makes sense.
As Browning said, one's extension of one's reach should not exceed one's grasp, or what is heaven for. And I think Souq News is doing that.
Africa needs a voice of truth, and Souq News has become one of them. And get ready, get ready, get ready.
And keep watching.
Keep watching Souq News.
Keep watching Souq News. It's a place to be.
Keep watching Souq News.
My name is Olatunji Shoti-Mirin. I'm a performing artist and, television radio presenter and a university lecturer, Unilag. Keep watching Souq News.
Hello everyone, my name is Kenny Black, Africa's finest music comedian, and you're watching Souq News. If you're not watching Souq News, I pity you, but keep watching Souq News.
Hello everyone, my name is Timmy Dakolo and you're watching Souq News. Stay tuned.
Hi, my name is Wisdom Oluwaseun Okoko, co-founder Orbit Africa Properties. I'm live at Souq News. Guys, keep watching Souq News for everything that concerns business, economy, politics, news. Souq News is your station.
Yes, thank you very much for staying there, hanging in there on Souq Pulse. Today, our guest to do justice to this particular episode is no other but a public health expert, a registered nurse, and she's been there for a while, making sure that people get healthy, not just on this divide, but across continents. This divide, but across continents. Distinguished ladies and gentlemen, my guest for today is Mary Ozuronye. Hello, Mary, how are you doing? Good afternoon. Okay, Mary, can you unmute your microphone? Mary, can you unmute your microphone?
Mary, can you unmute your microphone?
Can you unmute your microphone? Say hi.
Good evening, Chooks.
Okay.
Hello.
Yes,
It's
yes,
nice
you're
to
now
be
you're now
on
with
the
us. Can you
show
smile
this
again? Smile like twice. Like you really mean it. Thank you very much. Yes, it's nice to have you on Souq Pulse, Mary. Your surname Ozuronye. What does it mean?
Ozuronye is my middle name. My surname is Awolo.
Okay. What does Ozuronye mean? Okay.
So
What does Ozuronye mean? Okay.
The name is Mary Ozuronye Awolo. And Ozuronye means no one has a perfect life, you know. You understand? It's Delta Igbo, as people would say. There is nothing like Delta Igbo anyways, but people call us Delta Igbos.
That's a nice one. Thank you very much. I think I will adopt that name. Oh, thank you very much. Now, today we are looking at health tourism in Africa. We'll speak a bit on an Asian country, while we're also looking at the African climb. But before we get there, by the time we start talking about health tourism, the first thing people get to say is, what are you talking about health tourism? The people in Nigeria, have they gotten universal health coverage? That's the first thing that comes to people's mind. But like I said when I started the introduction, here we don't dwell on the problem. We go beyond there. If we can save money, if we can make money, then I think we have more to spend on things that are necessities and things that we really need to cover here. So let's take a prelim and look at the budget. 2001, some 46 African countries came together in Abuja and signed the declaration committing 15% of their annual budget for health issues, for health ministries, for health. And since 2001 till date, I think we've only had just 3 countries able to meet that 15%. Others are still struggling, but they are somewhere. This is like the first time Nigeria is having a budget that came this close, although it's 3% of the 15%. And we are having like 1.2 something trillion. In your own view, do you think the present administration should have done more on the health budget?
Yes, thank you very much, Chooks. Once again, it's nice to be on your show this evening. Yes, I feel the current government in Nigeria should have actually done more for health, to contribute more to the healthcare industry in Nigeria. But the question is, even if more money is accrued to health in Nigeria, how do we see the impact? What are the actions that we put in place to ensure that everything is being implemented and the society, the citizens can actually see and feel the impact of that money? We've heard a lot of money being allocated to various sectors in Nigeria in the past, and what we just hear is the trillions and millions and the billions and the money, you know, we just keep hearing it and hearing it. But we don't see the effect. We don't see the outcome. We don't see the implementation. We just hear it and it doesn't really work out the way we envision it. So it is not even just about allocating trillions of naira or millions or billions of naira to healthcare sector. It is really more of having the right persons in place to ensure that right actions are being taken so that the implementations will be taken for the citizens to enjoy what the money is actually meant for. So this is not just about money now. This is not just about the budget. It is also about the implementation. So if those 2 factors can come to play, then we can have a testimony with our healthcare industry in Nigeria.
Thank you very much, Mary. When you started, a particular word I love hearing. You said healthcare industry. I don't, that might have missed you, but you use that particular thing, meaning that yes, you know exactly where you're going.
You know exactly where you're going.
No matter what
Exactly
the
where you're
budget, no
going.
matter what
Exactly
the
where you're going.
implementation is all that matters. Which means we should be looking at civil servants, looking at civil servants, looking at budget impact, looking at okay, what are the civil servants doing to make sure that this particular budget gets together. But we are not dwelling on this evening. We are not going to call out this. Now we are looking at that single word to use, healthcare industry. Now we are trying to see. We have over 220 million Nigerians. That is just Nigeria alone. We have West African countries from Ghana, Cameroon, Cote d'Ivoire, where the nations have. So every other. Now there is an industry that is right beneath our feet, but we don't get it understanding. We see healthcare as more of nursing health. We don't see the business part of it. Can you please explain to us at what point in time did you really see the business part of healthcare?
I don't know if I actually got what you're saying correctly because your voice is actually giving me double voice feedback here, like an echo. So I really didn't get the question, but I know that you mentioned nursing and you mentioned something about other African countries. So please, Chooks, can I have the question again? I have double voice feedback here when you were speaking, so I couldn't really get what you said very well.
Okay, can you hear me very well now? Just give me a nod. Very well now. Just give me a nod. Okay, it's better now. Okay, good. I asked the question. I said, at what point in time, through your career or through your education or through your journeys, at what point in time did you get to see healthcare beyond just giving treatment and giving palliative or making people well? At what point in time did you see this as an industry, something that a country can hold on to and say, this is where we are focusing and we are going to make foreign exchange or foreign earning out of this? At what point in time did you get to see it?
Okay. So the point I got to see that was when I started practicing as a nurse. I didn't see that aspect of healthcare as an industry that the country can actually make revenue from. I didn't see it while I was training. You know, I attended School of Nursing, Obafemi Awolowo University Teaching Hospital. I moved on to Ladoke Akintola University for my bachelor's in nursing science degrees and public health. So at all that point when I was still training, I really didn't see the healthcare industry beyond. I didn't see the healthcare industry beyond us treating patients. I just saw it just within the scope of us working in the hospital. You know, people get sick, they come to us, and we administer care, and they are okay, we discharge them, and that's it. So it was when I graduated and I was out there in the field, you know, working in the hospital, then working in the public health sector, in the society. That was when I started seeing the different perspective, another side of the healthcare, another side of the service we render as nurses, as doctors, or as a member of the healthcare team. So it was at the point when I started working and practicing, you know, that was when I started seeing the healthcare industry as a different, in a different light, in a different perspective. You know, but I wish other professionals can also see it that way, and I wish our government can see it that way too, so that we all can be proactive in making a real industry out of healthcare in Nigeria.
Thank you very much, Mary. Now let's look at it from this angle. The federal government is going to fund our national budget for 2024 partly with loans. Now, on the flip side of it, West African countries annually spend over $1 billion on medical tourism. Now, if we can get 10% of this, a lot of those loans that we are seeking for we won't be looking for them. Now, let's look at our population, West African countries, other countries' population. Let's now put it population. India, let's now put
population.
It last year alone on statistics made well over 9 billion on health tourism alone. That is conservative. Now, India is positioning itself to be the hub for world health tourism. That is direct, intentional, not just marketing, but they are making everything possible. Now, let's bring this home. You have professionals like you that have dedicated themselves to say, okay, this is possible, we can do it. Now, our professionals are coming out from our universities, from our colleges of nursing, from other schools that offer health services. How can we keep them here? That should be the start. Those that want to go, yes, they can go. People say they can go, get there and send dollars back. That's good. But those that want to stay, how can we keep them here for a start? Then how can we start saying, okay, if you're here, then there has to be facilities for you to walk in. How can we start this first two? In your own way, what suggestions would you give us to say, how can we start this too?
Thank you very much. I love that first question of how can we keep them here. Sincerely, with the situation of things right now with the healthcare industry in Nigeria, you cannot keep professionals down. They will have to leave, and more of them will still leave if care is not taken. If we are not if we are not putting in some factors in place. One of the reasons I've had conversations with some of my colleagues who have left the country. You know, I usually tell people that people even ask me too that what am I still doing here? Like I should have left too. So I've had series of conversations with some of them who have left, and I asked them, okay, if you are in a situation to pick between staying back to practice in Nigeria and going over there, maybe to the UK. UK seems to be the country where most nurses actually went to in the last 1 year to 2 years, you know. So I have 5 of my colleagues who actually told me from within, like sincerely, they said that if things were different in Nigeria, that they would have loved to stay behind. You know, when they get there practicing and they compare, they're like, maybe if the kind of facilities they had over there, we have it in Nigeria, maybe they would have even preferred to work in Nigeria. If the economy was better, maybe they would have preferred to stay back, you know, if things were different. So coming back to the question of how can we make them stay? Number one, government have to improve the healthcare service in Nigeria. And when I talk about service, I'm talking about the facilities and equipment we use in offering this service. It is not just about the service providers who are the professionals. I mean, the doctors and the nurses, radiologists, lab scientists, and pharmacists, and all of them that make up the healthcare team. You know, it is not just about the professionals. It is what we work with. So if professionals have to improvise with what they have on ground, which is not enough for them to actually practice the profession in the best way they can. I mean, why would they want to stay? They would rather go somewhere else where all the factors is in place, you know, the facility is there, the condition is okay, and they would enjoy their profession better that way. You know, when we were in school, there are so many things we read about in textbooks, there are so many things our lecturers taught us, and we never got to practice them even during our clinicals in school. And now that we are even working and we are in the field, we've never really got to practice them because it is not operating here in the country, in our own country. But when you go out there, you see it operating there and you love it better. You love to practice better over there because the condition is better, the facilities is there, the equipment is there, and you just enjoy practicing your profession. That's one. Now, number two, the remuneration and how healthcare providers are being paid. A lot of them leave because they are not well appreciated. And I can actually tell you for a fact that this is true. The question is, how much do you pay doctors in Nigeria? How much do you pay nurses in Nigeria? How much do pharmacists, lab scientists, radiologists, how much do they get paid for the sacrifice they make for putting in their best to save lives. Even when the condition is not right, they still stick their necks out to ensure that they're saving life. How much do you pay them? So when they look at how much they will get paid over there, when they look at what they will enjoy, all the free benefits with good condition and everything, they'll prefer the good stuff. You know, that's one of the reasons why they have to leave. So if governments can actually review the remuneration for healthcare providers, the professionals, you know, if they can be well taken care of, better than what we have right now, and if governments can invest better in the healthcare industry by providing more facilities, you know, more equipment, and make the condition even better for both the professionals and the patients that will be receiving the care. You know, if everything is just, I mean, we will stay and we will not leave. You know, those are part of the things that the government can actually do to help us stay behind. But if not, if things continue the way they are right now, troops, I tell you, more nurses and doctors will still leave, and you have not even seen what is about to hit the healthcare industry in Nigeria.
Okay, thank you, Mary. I'm glad you're still here. So we will stay is we will stay. Now let me take you up on your last submission. We started with this being an industry, remember. Now let's make a comparison. Some years back, we had issues with the tech industry. Something happened that made a switch. Introduction of fintechs, homegrown fintechs. They made it possible for payment solutions to go seamlessly, which means I can stay in my home, do a code, sell it to Google, or stay in my home, work with Google, and Google will pay me in my house without me having to wait for a bank transaction for 3 days. Right now, we have Nigerians who are in their villages, as long as there is light, and they are working for organizations far away from Nigeria. Now, let's bring that back to the health sector. You said this is an industry, which is what we want it to be. If we keep depending on government, let's go back to Asia. That's always our comparison. A lot of the facilities in India, to be precise, are not owned by the Indian government. What the Indian government has done is open up that space and say, hey, players, come in. If it's tax waivers, we will give it to you. If it's support, we will give it to you. And you see a lot of hospitals, I can't call their names now because they've not paid us yet. You see a whole lot of hospitals and facilities and training institutes that are not Indian owned. Maybe they will own some shares in it, but you see them coming in and planting their facilities in India and making it possible. Now, with these facilities coming in, you are giving in more spaces for teaching hospitals to send students to go and get better. These facilities coming in is also giving more spaces for better remuneration and better spaces for people to work in. What can we do in this climb? Let's start with Nigeria, because I know our neighbors have started that already. What can we do in this climb to make and welcome this sort of investment?
Yes, we can actually welcome such investments, but proper planning has to be put in place if we want to welcome such investments. Let me give you an example. I know of a teaching hospital, which I'm not going to mention for reasons you know. I know of a teaching hospital that had a high-tech equipment being sent to them by, some well-meaning Nigerians or from abroad or something, I don't know. But an equipment, a very expensive equipment was sent down to that hospital. Everybody was happy. Oh, they brought this scan machine, blah, 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 and all that. And I tell you, that equipment was there for years. No one was using it. Not because I asked myself, is it that we don't have professionals who can operate this equipment? No, we do. We have people who can operate it. So what is actually going on? For reasons best known to the management of that hospital, the equipment was just there. They commissioned it. They celebrated the fact that that equipment was donated to the hospital and everything, and it was there for years till I left that climb. The equipment was never in use. I don't know if it is being in use now. So when things like this are going to happen, investment opportunities, people donating.
Do we have bad eggs? Certainly we do. Bad eggs are everywhere, but are we going to dwell on that? No, we won't. This Africa will move forward. These nations will move forward. We are looking at the health tourism in the light of being able not just to take care of ourselves, but making sure that those of us that leave this continent to go to other places, at least we reduce the percentage and keep those dollars and those hard-earned currencies here. Let's take a break. Souq Pulse will be right back.
My name is Olatunji Shotimirin. I'm a performing artist and, television radio presenter and a university lecturer, Unilag. Keep watching Souq News.
Hello everyone, my name is Kenny Black, Africa's finest music comedian, and you're watching Souq News. If you're not watching Souq News, I pity you, but keep watching Souq News.
Hello everyone, my name is Timidakolo and you're watching Souq News. Stay tuned.
Hi, my name is Wisdom Oluwaseun Okoko, co-founder Orbit Africa Properties. I'm live at Souq News. Guys, keep watching Souq News for everything that concerns business, economy, politics, news. Souq News is your station.
My name is Dr. Rafiu Oladipo.
My name is Baba Jalal Repega.
I'm Reverend Juliet Benite.
I'm Godio Didi.
My name is Professor Oladokun Sulaiman Olarawaju.
Souq News is on the ground, loading.
Very enlightening, very educative, and entertaining.
Thank you to Souq News.
So I'm happy that Souq TV has come into existence.
I'm happy to be here in the Souq News.
I want to encourage you to subscribe to the channel and keep watching news that makes sense.
As Browning said, one's extension of one's reach should not exceed one's grasp, or what is heaven for. And I think Souq News is doing that.
Africa needs a voice of truth, and Souq News has become one of them. And get ready, get ready, get ready.
And keep watching.
Keep watching Souq News.
Keep.
Hello and welcome back from the break. Mary, are you there?
Yes,
Hello?
please, I am.
Okay, thank you very much. You were giving us a description of what happened with the hospital. Okay, can you end
Yes.
on that note? Let's get to hear it.
Yes, please. So I said that the equipment was covered up for years and it wasn't in use. So what I'm trying to drive at is the fact that if we are going to be receiving such investment in terms of equipment and facilities to grow our healthcare industry, there are so many factors that has to be in place also. We need people who can operate these things. We need the right professionals, and we need proper planning for servicing and maintenance for all those things. And aside that, if we are calling for investors that, okay, come and invest in our healthcare industry and all that, it is not just about the industry they want to come and invest in. Looking at the environment they are coming to invest in an industry in, is the environment conducive enough? Now, you can have so many equipment in an hospital for you to use, and there is no light to operate it. That's an example. You can have every equipment in a hospital and the amenities, the right amenities to make that environment conducive is not there. So if investors look at all these things, all these factors that will play against them, they are investing in an industry and they expect to receive returns on investment. Of course, they need to make profits. When you do business, you make profits. So if the fact that the environment is not conducive enough, the fact that there are so many other factors that affect what your investment in that country is going to make you not get the returns you're supposed to receive on investments, you would never want to invest. If you are in their shoes, you won't invest too. So all these things need to be done. You would agree with me that recently a very big healthcare company that produces these popular medications for asthma and reproductive issues. That company just left Nigeria recently. And the moment they left, every medication and product they produce became very expensive. I'm talking about 100% more than the original price that citizens were buying it. And so many people today cannot afford these products even when they really need it for them to save their lives. So the question is, why did that company leave? That is not the only company that has left in recent time. A lot more companies have left Nigeria, and I'm telling you, more will still leave if care is not taken. So when other investors are seeing all these factors playing out, how do we want to convince them to come and invest in the same industry that some people are running away from? In the same industry that they know that the professionals that are supposed to work in that industries are all running away. So this thing is something that actually comes with ripple effect from one problem to another problem to another problem that constitutes a bigger problem. And if you want to solve it, it has to be solved from the foundation.
Thank you very much, Mary. Remember, when we started, we said our programming is not like what you get to hear outside. If we want to dwell on negativities, we will dwell on negativities for a full year, and I promise you, we won't be done. Now we are looking at, hey, how can we get out of this mud we found ourselves? And that is by collective work. And not just government, because government is me and you. On the issues of companies leaving, I'll get to say this. If we looked at each of those industries and took those industries like ours, and let's say I have 10%, even if it's 0.1% share in those industries, there are well over 1 million people that are wealthy enough to look at those industries and be part of those industries. The industry will not wake up one day and leave, because what? We are part of that industry. That is what is done in other climes. But on this side, we see industries as they are on their own, we are on our own. We go there to work, 5 o'clock, we go home. There is no ownership. I don't know if I'm making sense. It's the same thing that's happening in this country.
Yes,
we don't look at the country like our own. We look at the country as these politicians are going to stay 4 years. At the end of their 4 years, they go. Then maybe it's going to be our turn. Then when it's our turn, we go there and finish what they did not start. So we need to start ownership of both industries that are coming in here, the ones that are starting up. Whether you're working in there or you're not working in there, you contribute your quota. That way things will grow. Now let's leave it now and look at we're looking at comparisons. We'll see what is happening in Africa. We're looking at West Africa, and we'll see what is happening in Asia. We're looking at India. Now people don't just go to India because of the beautiful facilities or because of the beautiful business. India has been able to infuse their kind of traditional medicine into their medical practice. Am I right? Just give a nod, yes or no?
You're right.
People go there knowing fully well that this works. Apart from India, China does the same thing. Japan does the same thing. Acupuncture is almost like a normal thing. So how can we look at our own local traditional medication that we can say, okay, good, this is what is known, this is what works. Let's now start incorporating this. As long as it's approved by the appropriate quarters, how can we make people see Nigeria in our medicine? How can we domesticate our medication? How can we domesticate our healthcare? That way people have ownership of what is happening.
I really appreciate the perspective you're coming from, and I think it starts with the mindset shift. You know, we need to first of all work on our mindset and the mindset of the citizens of Nigeria and every other person involved to make this country grow. Every one of us, you know, we need to work on our mindsets. We need to work on how we actually view these things. Just like we said, if we can own it, we will definitely treat it better and things will be better, you know. So we need to work on our mindset, and working on our mindset comes with proper education, sensitization, and every one of us learning to embrace our own things and all that. I remember when the term of buy Nigeria was in vogue then, you know, like, okay, buy things made in Nigeria instead of relying on imported things and everything. You know, that helped people's mindset a little bit back then. You know, people started looking at, okay, fine, oh, let's, but there is still this subtle negativity that comes from the angle of, oh, anything that is made in this country is bad. I don't know where people got that from, you know, but people still have that subtle mindset that, oh, this thing is fake. It is made in Nigeria, then it is fake. Or it is made in Nigeria, then it will not last. You know, but, and then they trust things that come from other countries better than they trust their own. So that is where the mindset shift comes from. We need to work on our mindset first. And working on our mindset comes with, I love what you're doing at Souq News, you know, trying to ensure that you sensitize the public better, you know, looking at Nigeria in a better light, in a brighter light and all that. And of course, tradomedical aspect of medicine is actually thriving well. If only we all can learn to embrace it. The same thing happening in India today is not rocket science. It's just all of them learning to embrace their own things. But it is unfortunate that we in Nigeria are not learning to embrace our own things, but if we can, it would help us. You know, I know a doctor who trained as a medical doctor, studied medicine, and then later went to train in traditional medicine. You know, according to him, he said that that was what his own forefathers were doing, like it's like a family lineage thing for him. So that was why he went to study medicine in the first instance, because he felt, okay, medicine runs in his family, although his father and his forefathers did it in a traditional way. But even after studying medicine, he went back again to do trado medicine. And now he has a hospital where he treats patients not only with the usual medicine thing, but he also uses the herbs and roots and all that to also treat patients, and he uses the two, and it's working for him. So why can't we also invest in that as a nation? Why can't we encourage individual investors to invest in that aspect of pharmacy or pharmacology in our society? You know, that tradomedicine is pharmacology, you know, the herbs, the roots, all these herbs and roots can be made into tablets. I'm happy that some industries are already doing that, you know. So you see some herbs and roots made into tablets, capsules, you know. It has milligrams, it has proper dosage, and we use it. Some people use it and they say it works, but our mindset still needs to be worked on so that we all will learn to embrace it. If we don't embrace it, we'll still keep treating it like alien. We will not take it like this thing is our own. And if we can learn to embrace it, it will help us a great deal.
Okay, thank you very much. Thank you very much, Mary. Now, let's make that comparison again. Last year, we had over 4 million people visit India. 4 million, let that kind of sink in. Now, they went there to get a form of treatment. Now let's now look at the industries that benefited from that particular 4 million visiting. The aviation industry, the tourism industry, the food and services industry, the hotel industry. Definitely there will be patronage in the garment industry. Now, I don't know if you see the value chain all through, before you now start talking about the medical industry. Now, how can we, before we start attracting, how can we reduce the number of people leaving West Africa, outside the shores of West Africa, to seek medical attention or medical aid? Then secondly, this is where we are rounding up. How can we keep this money that we are spending here before we now start attracting more?
The only way we can stop people from leaving and taking that money, that bulk money over there, is if we have a better option for them here. As long as people can still afford it, they will keep going. But if there is a better option for them to stay back to receive better treatment here in Nigeria, they will definitely stay. Although there is still the mindset thing that I talked about earlier, about people trusting things that come from abroad better than their own things. So if our mindset is still not worked on, even if we have better hospitals now, we have all the professionals on ground, we have facilities, equipment, and everything is perfect and nice, we will still have some percentage of people who will still prefer to go abroad to seek healthcare service for whatever reason they didn't fit. But the fact is that one of the things we can do is, number one, let us embrace our own things. Let's embrace our own our own cultural practices that gives us that traditional medicine that we can actually infuse into our healthcare industry. Let's learn to embrace that. Now, number two, let's treat the professionals better so that the professionals can stay back. Because it is one thing for people to want to seek healthcare service in Nigeria, is another thing for them to have the right professionals who will be there to treat them. So if all the professionals have left, who will operate the facility? Who will operate the equipment? So if we treat our professionals better, and every one of us now starts seeing the industry as a big industry that we all need to contribute our quota, my own quota I will contribute into it might not be money, might not be monetary investment. It could be my time, my professionalism, me being there. So if every professional can think that way, that the only way we can build it is for us to be present, and we all can be present, it will be better. So these are part of the ways we can keep people to stay back. If they stay back, they will spend that money in Nigeria. All that money they're spending in India, in China, in the US, in Canada, and other countries that are well developed, they will stay back here and spend it here. So, and then let us also look at some of the services that we are not really rendering in Nigeria that they feel is easier over there that they actually go to enjoy. For instance, looking at organ transplants. Organ transplants in Nigeria is still the leg of that service of organ transplants in healthcare industry in Nigeria is still shaking. It's still not very, very perfect to the level that it should be compared to other countries. I'm using that as an example. So, because if you're talking about something we call organ bank, we really don't have organ bank in Nigeria. Even blood bank itself in most hospitals is not really very standard. So, if some of such services that are not being rendered in Nigeria can be improved and we start rendering them, like, oh, someone wants to have a kidney transplant, you can easily have it in Nigeria. Someone wants to have a liver transplant, you want to have an open heart surgery, all those high-class surgeries that people would rather go to India to go and do, and you can easily do it in Nigeria. All the services can be done here. The professionals can be here to perform the surgeries and everything. Fine, people would rather stay. They would rather stay and do it here instead of traveling over there. But because it is not in place, that is another reason why they are leaving. So all this, in fact, if we really want to solve this problem, we have to solve it from various angles, including changing our mindset. And I tell you, if we can solve the problem of this healthcare tourism and everything, Nigeria will save a lot of money. All the money going to the economy of other countries will stay here, and it will boost our own economy. Why can't we have a Nigeria where other people from other countries come here to also receive healthcare service? I mean, can't Americans come here for surgery? Can't Canadians come here for surgery? Can't Indians come here for surgery also? They can also come for healthcare, for the healthcare industry to also grow. We want them to also come to our country, but if they will come, we have to be ready to give them the same value they are enjoying in their country.
Thank you. Thank you very much. Thank you very much, Mary. You've been an awesome guest. We say thank you very much for coming, and we will call on you in the near future, and we hope you will answer us. Thank you very much. very much.
Of course, sure. Thank you very much for having me.
You're welcome. Now, we want to say thank you for staying there, hanging in there, and watching and being with us all through the show. Remember, charity begins at home. To everyone formulating the policy and making sure that health care here is well and will save a whole lot of dollars, we also appeal to you. Don't spend our money traveling outside for health tourism. Fix it here and let all benefit. Thank you very much. My name is Souq and it's still Souq Pulse. Thank you and have a nice day.